Hello everyone, my name is Anmol. I'm a doctor based in India, and in this video I am going to be talking about everything that has to be done before the NEET PG counselling starts, right from how to pick a branch of your choice to deciding upon which colleges to pick. I will try my best to guide you regarding each of these things based on my experience and what I've learned so far. I underwent this whole process in 2019, so I would be telling you about how I think you should approach the two major dilemmas that students experience before the NEET PG counselling, that is which branch to pick and which colleges to pick. I will also briefly be discussing about MD/MS versus DNB. So let's get started. First of all, many congratulations on qualifying NEET PG. I know it feels like a victory to have qualified this extremely tough exam, so kudos on that, but a very important part still remains. The ultimate reason why you went through it all. Choosing your partner for life, the branch of your choice, and choosing a college where you'll be trained. The problem is, especially in India, we are so immersed in preparing for NEET and we're so preoccupied with the thought of just being able to crack NEET with a good rank, we often tend to forget what happens after that. So once you crack NEET and it's time to choose a branch, if you're very clear in your mind that, okay, this is the branch that I want, this is my dream branch, and these are my reasons for choosing it, then that's great. But if you do not have that clarity, if you're not very sure of which branch you're going to pick, it can result in a lot of panic and confusion, and that can sometimes lead to you making a rash decision while choosing a branch, and in the process picking a branch that you're not really compatible with, which can be very harmful in the long run because your branch is something that will determine a lot in your life henceforth. It's not a small decision. Now, these are the two biggest mistakes that I think people make while choosing a branch. Picking a branch because it looks fun or sounds fun. Now, don't get me wrong, there's nothing wrong with dreaming to be a surgeon or a diagnostician after watching Grey's Anatomy or House MD. But all I'm trying to say is that before you choose a branch, make sure that you have experienced it firsthand. Make sure you have spent at least a day working as a resident in that branch at a government hospital in whichever city or country you're planning to work, because that's going to be your life from there on for at least a while. You can also talk to someone who's currently living that branch, who's currently working as a resident in that branch. You can spend a day with them, see what goes on in a day in their life, get to know as much as you can about the branch, all the pros and cons, and then make an informed decision. If you're interested in dermatology as a residency, I have a video on my channel where I've spoken about basically what goes on in a day in my life, and I've tried to document it. So you can watch it and get an idea. I have put the link in the description below. There's another video on the pros and cons of dermatology. So if you're interested in dermat, you can basically ask me on Instagram as well. You can ask me in the comments below and I'll be happy to answer. But basically these two videos will give you a good idea if you're interested in dermat as a specialty. A second common mistake is giving more importance to college over branch. It can be tricky, what to do, whether to pick a branch first or pick a college first and then decide the branch. But I would recommend, as far as possible, first decide on a branch and then pick a college, because you can always learn later through fellowships and senior residency, and whatever gap there is, it can be overcome as long as you have the right branch, the branch of your choice by your side for the rest of your life. Okay, so basically we have established that before the NEET PG counselling starts, there are two things that you need to be very clear about in your mind. Which branch do you want? And also a list of colleges based on your preferences that you're going to fill. So let's talk about each of them one by one. So for instance, you're starting from scratch. You have no idea which branch you want to pick. Here's an algorithm that I've created that might be able to help you. The first thing that you need to decide is whether you want to go for a clinical branch or a non-clinical branch. If you want to go for a non-clinical branch, or for some reason you have to pick a non-clinical branch, then your options are anatomy, physiology, biochemistry, pharmacology, pathology, microbiology, PSM, and forensic medicine and toxicology. Now, if you cannot decide amongst these that which non-clinical branch to pick, here are some questions that you can ask yourself. Number one would be, which subject do I like the most? Your interest in a particular subject will be the most important thing to determine whether you're going to pick that branch or not. This is in fact true for any branch that you may pick. You have to like the subject, you have to be interested in a subject. If you hate the subject, if you dislike the subject, I would seriously recommend do not pick that branch. Because especially in non-clinical branches, a significant part of your career and your time will be spent in studying the subject and researching about the subject. So if you do not like the subject, it's a big no. Rule it out and choose the one that you're most interested in. Second thing that you can consider is the future prospects of that branch. For example, there's always an option of opening up a diagnostic lab in case of pathology and microbiology. It'll be better if you talk to respective residents of each of these branches and get an idea of the future possibilities in these branches, and then you can decide. But most importantly, decide based on your interests and your inclination towards the subject, especially for non-clinical branches. If, according to the algorithm, you want to go for a clinical branch, then your options are ophthalmology, ENT, pediatrics, OBGYN, medicine, surgery, radio, ortho, dermatology, anesthesia, and psychiatry. These are your options. Amongst these, the next thing that you need to decide is whether you want to go for a surgical branch or a non-surgical branch. Among surgical branches, you have ophthalmology, ENT, OBGYN, surgery, ortho, anesthesia. And amongst non-surgical branches, you have your medicine, radiology, dermatology, pediatrics, and psychiatry. So now, how to decide whether you want to go for a surgical branch or a non-surgical branch? Ask yourself a simple question. Are you interested in doing surgery? It's as simple as that. Am I interested in surgery or not? If you have the skill of a surgeon, if you have those steady hands, if you have the stamina of a surgeon, if you have the stamina to operate for long hours, and if you do not crack under pressure, if you are able to handle pressure well, and you're able to work well in a high stress environment that you're most likely to encounter in a surgical residency, then you can go for any of the surgical branches that are in the options, that is your ophthalmology, ENT, OBGYN, surgery, ortho, and anesthesia. Once again, as for any branch, I would highly recommend that you go and work in these departments for at least a day and experience a taste of what residency is like in any of these branches, just to be sure. On the other hand, if you're clearly not interested in doing surgeries and you have more of a physician's brain than the surgeon's hand, then you have all of these options: medicine, radiology, dermatology, pediatrics, and psychiatry. Now be very careful in picking a branch amongst these non-surgical branches, because each of these is very different from each other. I have just clubbed them together in the category of non-surgical branches because they are non-surgical, but they really differ from each other. People are often confused. They ask me, I'm unable to decide whether to pick between radiology and dermatology or between radiology and medicine. Very different. Both options are very, very different. I think to become clear about which non-surgical residency to go for out of all of these, the first thing that you need to be asking yourself is whether you want to work under a high stress environment and whether you want to do emergencies or not. If yes, if you can work well in a high stress environment and you are interested in an emergency branch, if you're okay with going for an emergency branch, then medicine and pediatrics are an option for you. If the answer is no, I don't want to do emergencies, I want a relatively cooler branch, then the options are dermatology, radiology, and psychiatry. Although I would like to point out here that radiology can be an emergency branch sometimes. So basically, amongst the non-surgical branches, you have medicine and pediatrics on one side, which are a little more basically hectic, which have emergencies and slightly longer working hours as compared to radiology, dermatology, and psychiatry on the other side, which are considered relatively cooler branches because they have an easier work-life balance. So if you've decided upon a non-surgical emergency branch between medicine and pediatrics, I think you can choose based on whether you would like to have tiny humans as your patients or adult humans as your patients. Otherwise, in all respects, they are both quite similar. If you have decided that you want to go for a non-emergency, non-surgical branch and you have radiology, dermatology, and psychiatry as an option, now let's talk about each of these one by one because they are quite different from each other. All of these three branches have one thing in common. They have a good work-life balance and they are basically less stressful and less hectic. Radiology is a branch that you can go for if you do not want any patient interaction. So if you're okay with having no patient interaction and basically not having that part of the job satisfaction, if you like to work from behind the scenes and you're okay with working on a screen for longer hours, then maybe go for radiology as an option. Also, radiology is a very relevant branch these days in the sense that it has a very, very important role to play in diagnostics. In every other branch, the diagnosis that you make is basically based on the radiology. So it's very relevant clinically. That is a good thing about radiology. And the other advantage is that it's work from home is a possibility. The only branch where work from home is a possibility is radiology. So maybe you can make a decision based on this, whether you would be interested in radiology or not. And also you can visit the radiology department and see what it's like. You can see the atmosphere. And if you see yourself working there, then radiology is a good option for you. Dermatology, I'm not going to talk about in much detail today in this video because I have already spoken about it in a previous video that is there on my channel. I've put the link in the description below where I'm talking about the pros and cons of dermatology as a residency. So if you're interested in dermatology but you're confused, you can watch that video or you can connect with me. Psychiatry as a branch is a lot about how interested you are in psychiatry. I really think that the world needs more of great psychiatrists. So again, it's a branch which is very, very relevant in the current scenario. It's also very interesting. So if you think you would be interested in doing psychiatry, talk to someone who's working in psychiatry as a resident to get a better idea about the branch. But what I feel is that if you're interested in the branch, you'll be able to do well, and it's a very relevant branch. Now let me talk about two things that you should not base your decision of picking a branch on. Number one is money. I see a lot of people these days trying to make this decision of choosing a branch based on how much it earns, but I really don't think that it should be a prime determinant while picking a branch, because I don't think that how much you will end up earning is necessarily dependent on which branch you pick. This is contrary to popular belief, but this is what I feel, and I don't think that there are any barriers to how much you can earn. I think there are opportunities in each branch if you have the skill, if you have the passion for it, if you have the desire to make a change, and if you really want to earn, you can earn in any branch. So I would personally recommend not worrying about that too much. Don't think about it right now. Don't think about that, oh, if I'm going to pick this branch, whether I'll be able to earn money or not. You'll be able to earn well no matter what branch you pick. How much you earn as a doctor depends on your skill, your knowledge, your desire to make a difference, and every branch is filled with opportunities. So don't worry about that. Don't decide on which branch to go for based on how much you think you'll earn at the end of it. Second thing would be not picking a branch based on what rank you have. What I mean by this is, do not pick a branch just because you can. Do not go for radiology or dermatology just because you have a good rank and you're getting the branch. So don't let your rank influence the branch that you want to choose. Choose it with an open mind, with an unbiased mind. Consider all the points that I've mentioned above. Make a decision based on your interests and your caliber, and not just because you can pick the branch. Another thing that people are confused about is whether to go for MDMS or to go for DNB. The difference between the two is very simple. There are two differences. First, if you later in your career want to work as a professor at a university or a college, then MD or MS candidates would be given more preference over DNB. That is the only thing where which degree you have amongst these two will make a difference. So for jobs as professors or for jobs as senior residents or professors, MD and MS candidates would be preferred over DNB. Secondly, you can always do DNB after you've done your MD/MS, but you can never do MD later on. So that's another difference between these two. But if you have decided that you want to have a corporate setup later on, and you're not going to do a government job as a professor, then I think it does not make that much of a difference whether it's MD/MS or DNB. So finally, after you've chosen your branch and you've decided upon the degree, the last part is picking a college. So before counseling, you should have a list of colleges ready in the order of preference that you're going to fill them in the counseling. So there are 5 points to consider while picking a college. Number one, academics and teaching. That should be good, especially for non-clinical and non-surgical branches. For surgical branches, an important factor is hands-on training. How much you will be able to get, that would decide which college to pick. Number 3 would be the facilities available. For instance, if you're picking radiology, then make sure that go for a college that has an MRI machine, or that has as many equipments that are necessary for radiology these days, so that you're able to learn. Similarly, for dermatology, try to get into an institute that has those facilities, of lasers, of cryotherapy, dermatosurgery, so you can learn all of these things. So the third thing would be how the facilities, the equipments, etc. are in that college. Fourth thing would be the patient load. The more the better. The more the OPD number, the more the IPD patients, the more you're going to learn. And fifth would be city. Always prefer sort of metro cities over peripheral centers, because that would give you more exposure and you would be able to attend conferences there and basically hang out with people who are working, even if you don't get the best institute of your choice in that particular city. But if you are in the city, you can always hang out with people who are working there. You can go there, see the scans. For instance, in radiology, in dermatology, you can see the procedures. You can always go there and experience what it's like, and you can learn through that. So always prefer to go for bigger cities over peripheral centers, because that would get you more exposure. So these are the 5 things that you need to consider while picking a college. That is the academics and teaching, hands-on for surgery, patient load, the facilities and equipments available there, and finally the city. The best way would obviously be to try and get in touch with some senior or some faculty who has worked there or is currently working there, and try and get an idea of where the institute stands with respect to the above parameters. So this is basically an outline of what to look for while picking a college and how to decide which one to choose over which. So I hoped this video helped you in basically trying to form an approach of how to decide on which branch to choose, how to decide on the degree, and which colleges to pick. I wish you all the best for the counseling. If you have any doubts related to the counseling process or anything else, you can get in touch with me. My Instagram ID is on the screen below. You can also drop your questions in the comments below and I would be happy to answer them. If you found this helpful, please like the video, share it with your friends and subscribe to my channel. I'll see you in the next one. Bye.